Should you do physical therapy after knee surgery? I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of sports and exercise, injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. I talk about the benefits of physical therapy so much, and so in this video I'll probably do that again. But one of the questions I get, because I do so many knee surgeries every year, as most orthopedic surgeons do that do sports medicine, probably knee surgeries are the most common types of surgery, or the most common body part where we do surgeries. One of the questions that I get, and I have no doubt other sports medicine surgeons get, is, do I really need to do physical therapy? Can I get my knee better on my own? And so in this Ask Dr. Geyer video, I'm going to answer that very question. Jimmy asks, is it possible to rehabilitate your knee after surgery without a physical therapist? Well, Jimmy's question is absolutely fair. And I guess there's a difference, and where I would start off first would be the difference between can you and should you? And that's a little tricky, but let's get into that. Can you get better after knee surgery? Absolutely. I mean, nobody's making you do any kind of physical therapy or anything else after surgery. Some of it depends on the type of surgery. There's some surgeries that are a lot easier to get over than others. If it's going in arthroscopically through the scope, where the surgeon goes in and trims out part of a meniscus tear, what we call a partial meniscectomy, you may be able to get your motion better and your strength better and your swelling down and get back to whatever it is you like to do, very quickly without the help of a physical therapist. I have people do that all the time. Yes, we send you home with some home exercises and offer you physical therapy, but I know people can get better on their own. A bigger surgery like an ACL reconstruction or a surgery, other ligament surgeries or cartilage surgeries like microfracture or osteochondral transfers and a variety of other big knee surgeries, that may be a lot more difficult. Fractures around the knee, tendon repairs around the knee like the patella tendon or quad tendon, patella dislocations, those are usually much bigger surgeries, and it can be much harder to get over the surgery. Getting your swelling better, getting your motion back to normal, getting it all the way straight and bending all the way like the opposite side, getting your strength back, getting all your balance and ability to land and cut and agility. That all can take a lot of work, and that can be difficult without a physical therapist. So most of the time we will send patients to physical therapy after those busy surgeries. We usually insist on it. Again, that can be tricky based on insurance and out-of-pocket costs and things like that, but a lot of times we'll strongly recommend it. But even for the minor surgeries, I would argue that it can be a good idea. I think, yes, after a surgery like a partial meniscectomy, you very likely would get back to normal over some period of time. 3, 4, 5 months, you'll reach what we call maximum medical improvement. I think physical therapy, if anything, can get you there faster than you would maybe on your own. Maybe can get you there safer. They can identify things that just don't seem right and tell you, hey, you may want to let your doctor know about that. They may have modalities that can help get your swelling down or get your strength faster, like E-stem or ultrasound, or those may just help get your pain under control faster. They've got equipment that you just don't have. They can test your agility and your balance and things that are really hard to do on your own. They can see an abnormal walk, an abnormal limp, either when you're just walking or when you try to start jogging that you might not notice on your own. They can put you through drills that simulate your sport or your exercise and the movements that you need to make in those sports. I'm a big fan of physical therapy, and so I think that after a knee surgery, and to be fair, this is true after shoulder, elbow, ankle surgeries too, I think that if you can do physical therapy, very, very often it's a good idea to do physical therapy. Okay, have you had a knee surgery and did your orthopedic surgeon send you to a physical therapist? How did it go? Or have you tried to rehab your knee after knee surgery on your own without physical therapy? I would love to hear your experience, and I bet readers all over the world with a knee surgery coming up they may love to hear your experience as well. So below this video, share your experience. Share your story. What did you have? What did you do? How did it go? Like I said, I'd love to read it, and I know people dealing with this problem would love to read it as well. If you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, subscribe to my YouTube channel. There's a subscribe button in the upper right corner of this page. I record a couple of these videos every single week, and they'll get delivered directly to you. Thank you so much for watching. I really hope this was helpful. If you know somebody about to go through knee surgery, definitely share this video with them. I would love to help as many people as possible. Again, thank you for watching, and I look forward to seeing you right here next time.